Since we talked about a great deal at the previous thing, now let's talk about the every type of connection between our joints. Now there are lots of joints here. One is knee joint and it has ligaments in between them. And cartilage is also present there in between these joints. What is the function of cartilage? Have you ever seen a joint, like it is a case that you will experience yourself as well? As the ages go, this process occur, and the name of the process is called calcification of cartilage. Cartilage begin to calcify under deposition of calcium. This occurs, and you can prevent it. No, it's doomed to happen. Calcium begins to seep into your cartilage as you get older at the age of 50 to 60, or if you are healthy, then maybe after that, but it will be there. And sometimes, if not the proper nutrition or the proper diet, it can come even early as well. What happens in this type of thing is like lots of salt is deposited on the cartilage, so cartilage begins to get calcified, and due to the calcification it begins as an extension of the bone, colliding with the simultaneous nerves, and protruding large amount of pain. So it's very unhealthy first of all, as it creates swelling, inflammation, various type of bacteria get there, and a lot. But there's no benefit to it. Let's be clear here. It's just made to make you weaker. It's making you weaker because what happens if the calcification is done there? Nothing. Just the cartilage are now being destroyed. That's the thing. So flexibility is reduced. Also, if you are doing heavy running right now, then be sure to absorb the shock coming through your feet and hips, through your knees, because these type of impulses, the sudden one on your knees and hips for long term are not great. So to keep on going with a consistent pace and a consistent body, you need to be running at a soft surface with a good pace, not like exaggerating your run and running so fast that you should give up, throw up, and something like that. It only hurts your body. Don't push your body to the limit. It is not meant to be pushed at the limit, and you can never push it at the limit because your body has a locking system. It only pushes itself under some hormones, and under those hormones as well, not all the things are pushed. Like the breathing is increased, the heartbeat is increased, but the digestion is just put it down. In which case, in the production of adrenal gland. Adrenal gland secretes adrenaline, which helps in increasing the blood flow, increasing the heart rate, increasing the breath rate, but it constricts, it prevents the digestion, it contracts that, and many more. So lot of thing occurs under the adrenal gland, and your body is a limiting factor. You should keep the limiting factor because it is meant for there, not only for any type of thing. There is limits on everything these days. You have eating something, you're eating something, then the limiting factor here is your epiglottis. After that comes the sphincters of the stomach, after that the fundus and everything inside. After the stomach there is the rectum. So limiting factor of the outside external thing to the internal thing is always present. If and only the thing is verified, then it will be able to enter. If not verified, should not enter, will not be able to enter, and if enters, then it can be hazardous. So that's the thing. Your body is like everything is well kept, everything is well maintained. If you're smelling something out of the ordinary on your body, It's a message by your sense organs to understand yourself and think that there's something yuck present around the body that shouldn't be there. Because the function of the nose is to detect and smells which are not supposed to be there. So that's the thing. If your body is like perfectly fine, then there should not be any foul odor. So each thing is like well maintained, well kept in your body. That's the thing. Thank you.